The Africa we want talks about the health and the well-being of all Africans. So for governments to have the capacity to reach everybody in the society, for governments to make sure that people in the urban areas, in the rural areas, they have accessibility to the health services, they have affordability, it's impossible to be done with governments alone. That's why talking about public-private partnership is part of our mandate. We are always seeking partnerships with private sector in Africa.
As a country, if you really want to achieve all UHC's big aspirations that we can achieve as SDG 3, we need the private sector engagement, not only at service delivery level, but from the policy dialogues up to the end results.
The government on its own will not have the time, the money, nor the skills to do it on their own. The idea then is to invite money, skills and time from the private sector to work together with the public sector to deliver for our people.
Overall, the private sector engagement in the health, and especially the coordinated engagement with the public sector, with government, with ministries of health, is really critical in advancing the vision of achieving universal health coverage and SDGs, and also building strong health systems.
Primarily as an African and as a public health practitioner, also very importantly as a member staff of the United Nations Population Fund, looking at how we can improve health outcomes, especially for Africa's most vulnerable, women and girls, and of course children. It is clear that relying only on public health systems or public health expenditure will not take us to where we want to go. We must be able to leverage the capacities of the private sector. We must be able to leverage the financing inherent in the private sector and the innovation to ensure that we can actually leapfrog a lot of those interventions that we have in place to potentiate result delivery.
While it is the government's responsibility to provide health care to the population, it is not wholly possible because the private sector has also an equal important role to play.
Lack of trust, that is the biggest challenge that we have. And we'll see that in countries where we have managed to narrow the gap of trust, a lot of things are happening together.
What I think is lacking now is we haven't had organized, structured private sector like we have now with your group. And I would like to call upon your group to come forward and engage better and more with the others, basically government and also civil society.
Private sector is sometimes forgotten about when you start talking to governments, and yet we know there's this massive amount of private sector work going on throughout the African continent, and if we could actually get the two to talk together, we think we can actually solve a lot more problems together.
The problem in our region has been multiple, and this has been the major discussion in this conference, that while both the public and the private sector are willing to work together, we often do not have an enabling environment for that to happen. The private sector is complaining, the public sector is complaining. In the meantime, disease is winning the war. So what we are urging in this conference is that we have no time to complain. Disease is not waiting for you. What we have available in your hands, whether it is public or private, must be used, and used in a manner that makes us make progress.
Governments realize the need to engage with the private sector. I would say a couple of years back it would have been a different dynamics, but today governments are eagerly looking forward to have the private sector to engage with them and to take the message, take the technology and bring it up there. And relationships are improving day by day, yeah, as it's a win-win situation for both of us here. Yeah.
Slowly and slightly, we've seen this concept of public-private partnership happening, and the door started to get open, and it was really easier to communicate with policymakers, key stakeholders, explaining concern, explaining how we can support, how we can understanding also how we can support, because this is also another thing we need to understand.
In the last few years, this partnership, it's really advanced. It's really becoming effective, especially in the last 6 or 7 years. We witness the private sector of Africa coming when the African Union called for them to come and support the West African countries who are affected by Ebola during 2014 and 2015. Africa private sector, they came, they worked with African Union, they worked with governments, and they really played a very important, crucial and effective role in combating the Ebola at that time.
It is possible and feasible for the private sector to team up with the governments. I have seen successful projects in Uganda with the faith-based, where we agreed and signed MOUs with them to provide health services in defined areas using government funds.
Our president, the political leaders, join hands with the technical people and also the other development partners and the private sector in dealing with the challenge. So we've been able to even nib the few cases that have been reported. In a record time, we ensure that doesn't spread the entire population, but just because of the support, we can't do it alone. Support from the private healthcare providers, support from the communities, support from the political leaders, and everybody really gets engaged.
To my mind, we are starting to make the kind of change that is required. The narrative is changing. The public-private partnership is what is required, but public-private dialogue is actually the start of it.
So the ideal private sector is the one that they really want to work in collaboration with the government to aspire and to fulfill all the citizens' needs.
So there are massive opportunities. I mean, I look at the subject I'm very passionate about, of course, is the healthcare worker piece, and there is underinvestment in health education. It's, you know, yeah, when you see that if you open the doors, people come in and they start setting up schools and all of that, I think we should encourage those. We should encourage more public-private partnership to create more schools, to provide more opportunities for training. The reality is the development model is changing. And the new development model is going to have a lot of market-based solutions. The minute you talk about sustainability, you're talking about creating a system where people can begin to finance their own. And that means market-based.
I believe that the public sector has to make that commitment to ensuring that the private sector can get the financing needed to be that contributor. So it would mean, you know, setting up the right investment climate to crowd in investors to look at the private sector. It would mean providing incentives like, you know, tax incentives or, you know, various types of other incentives that can encourage the private sector to invest more in healthcare.
We can make this partnership a reality on a win-win base, because we know what are the interests of the private sector. But we need a dialogue between us and the private sector, because also looking to the profit side without looking into the side of making sure that it's not about profit making, it's about the health and the well-being of the people. That's why we need to strike a dialogue that will continue between us and the private sector. There is a dialogue, of course, within the private sector itself to come as one. We need this dialogue to be between the private sector and between us in the African Union. And to do it, we don't want a fragmented private sector. We want the private sector to be integrated.
By integrating that institutional stewardship of governments with on-the-ground support from us and civil society actors, you could have a huge impact.
We start with the private sector, we scale with the public sector, because the private sector gives us a lot of learning, but we know that in order to have a bigger impact, we need to work with the public sector.
Private sector healthcare creates good paying jobs and creates future leaning jobs. You can bring in technology. So we think it's actually all part of a symbiotic whole.
That's the fun part about these PPPs. We learn from government and implementation, but we can also share our vocabulary and look at it more from an ROI perspective, right? So
with the private sector, it's a bit more difficult because we have to establish a mind where competition is not there. You know, we have to believe all the players from the private sector that we are here to complete each other's, not to compete with each other's. If we don't reach that stage, I don't think that we can reach better outcomes.
So it is possible. We have evidence that it can work well.
This kind of platforms, they provide us with the opportunity of connecting with the right like-minded people and trying to hear the best practices happening across, trying to hear challenges from the other side, and also trying to arrive at a common minimum platform.
I'm an optimist, and I still think that if we harness the potential of everything that exists, that this should not be just public sector responsibility. I think the private sector has a lot that they can bring to the table, and I think technology is a game changer when it comes to either the way they train people or the way that we provide decision support and so forth. So I think it's still doable, but it is challenging.
We must also appreciate that governments don't innovate. It's the private sector that gets these innovations, and we have to pick from them. So this partnership is quite crucial. We need to collaborate with the private sector and work together so that we can be able to achieve our sustainable development goals and of course the universal health coverage that we all yearn for.
All the private sector who works in the health issues can come together because governments need the private sector on the national level, on the regional level, and on the continental level.